Hello everyone, I am myself Dr. Rajesh Gubba. In this session, I will be discussing a very important topic in the cardiology, that is the neoplastic diseases of the heart. So, if you take these neoplastic diseases, we have the primary cardiac tumors. These are the tumors which are originating from the heart or the pericardium, and we have the secondary cardiac tumors which are nothing but the metastatic tumors. Okay. So, if you take the primary cardiac tumors, as such, these are very rare tumors, okay, and these primary cardiac tumors, they constitute only a small fraction of all tumors that involve the heart or the pericardium. So these are the tumors originating from heart or these are the tumors which originate from the heart or the pericardium. Now, out of which, let me discuss the most common primary tumor. So, if you see the most common primary tumor, it is the atrial myxoma. So, atrial myxoma, it is the most common it is the most common primary tumor. And it comprises about 50% of all tumors in adult case series. And when you are using the word atrial myxoma, where is it originating from and where is it attached? It is generally attached to the atrial septum. It is generally attached to the interatrial septum. And which side it will grow? It is more likely to grow on the left side of the septum rather than to the right atrium. Okay, so this is more likely to grow towards the left atrium rather than the right atrium. This is more likely to grow onto the left atrial side of the septum rather than the right atrial side. And patients with atrial myxoma, they can rarely present with the characteristics of the systemic illness. Okay, so rarely they have the features of the systemic illnesses. And what will be that features of the systemic illnesses? We will discuss that. Okay, and they also have the features of the obstruction of the blood flow at the mitral valve leaflets. Okay, so they also have the features, because now if you see, this is the four-chambered heart and this is your tricuspid valve, and then we have the mitral valve, and this is your atrial myxoma. Okay, so the atrial myxoma, which is originating from the interatrial septum, it can cause the obstruction to the mitral valve inlet, in the sense, okay, so there will be obstruction of the blood flow at the mitral valve level. So they will have the features of obstruction of blood flow obstruction of the blood flow at the mitral valve level, or they also have the signs of peripheral embolization. They also have the signs of peripheral embolization. So these are some introductory points to your atrial myxoma. Now, what are the clinical features of the atrial myxoma? So I said you, these individuals, they also have the features of the systemic illness. And what will be the features of the systemic illness? The syndrome includes the fever, there can be development of malaise, weight loss, and leukocytosis, fever, malaise, weight loss and leukocytosis. And not only that, they will also have elevated ESR. Right? Not only that, they also have elevated ESR. So these are the systemic illnesses features in patients with atrial myxoma. And I said you they also have the features of embolization. This atrial myxomatous tumor, right, it can rupture and it can emboli into the peripheral circulation. So the features of embolization, they might be in the peripheral vessels, right? The features of embolization, it is in the peripheral or the pulmonary circulation, right? In the peripheral or pulmonary circulation, depending upon the location of the tumor. Like for example, if it is like left atrial myxoma, then the embolization will be in the peripheral circulation. But for suppose if it is like right atrial myxoma, then the embolization will be in the pulmonary circulation, right? And this atrial myxoma, it is sometimes confused with infective endocarditis. Right? It is sometimes confused with infective endocarditis, lymphomas, and as well as autoimmune diseases. Right? So this would be a differentials for your atrial myxoma. And in other cases, the tumor may grow to considerable size and produce symptoms by simply obstructing the mitral valve. That is, in certain cases, this particular tumor, it grows very large in size. When it grows very large in size, what will happen? You can observe that here. This particular tumor, when it grows very large in size, it can cause the obstruction of the mitral valve leaflet. So there will be obstruction at the mitral inflow. So, right, so if the tumor is very large, there can be obstruction at the mitral inflow. So once there is an obstruction at the mitral inflow, what will happen? The left atrial pressure increases, subsequently pulmonary venous pressure increases, subsequently pulmonary capillary wedge pressure increases, and that will result in the development of pulmonary edema. Right, that will result in the development of pulmonary edema. So episodic pulmonary edema and signs of low output may result. Okay, so episodic pulmonary edema and there will be signs of low cardiac output. So these are the features of the atrial myxoma when it is present in larger in size. Okay, so these are the clinical features. So to summarize, most common primary tumor of the heart is atrial myxoma and it constitutes 50% of all tumors in adult case series. And it is generally attached to the atrial septum and it is more likely to grow on the left atrial side of the septum rather than the right atrium. And these patients, they have the characteristics of systemic illnesses and they also have the obstruction of the blood flow at the mitral valve level, or there will be also signs of the peripheral embolization. And the clinical features of atrial myxoma, if you take the features of the systemic illnesses, they include the fever, malaise, weight loss, leukocytosis, and there will be elevated ESR. And this atrial myxoma, sometimes it is confused with infective endocarditis, lymphoma, or other autoimmune diseases. And in other cases, the tumor may grow to considerable size and produce symptoms by simply obstructing the mitral inflow. And thereby, there can be an episodic pulmonary edema and they also have the signs of the low cardiac output. Now, if you take the physical examination findings, so this is the tumor, right? This is your 4-chambered heart, right? This is the atrial myxoma. Okay, so now whenever the left atria contracts, the left ventricle is in the stage of the diastole. And when the left atria contracts, the myxoma, it tries to comes and hits the mitral valve. And that will produce a sound that is called a tumor plop. So physical examination may reveal a diastolic sound, right? A diastolic additional sound. Okay. And why is that I am using it as a diastolic additional sound? Because when left atrium is contracting, the tumor is hitting the mitral valve leaflets or mitral inflow. And at that moment of time, the ventricle, it is in a stage of diastole. Right, ventricle, it is in a stage of the diastole. So that sound whatever is heard during diastole of the ventricle, and that is the reason why we consider this as the diastolic sound. Right, and what is that sound? That is your tumor plop. Right, that particular sound is the tumor plop. Okay, right, and this tumor plop, right, this particular tumor plop, it is, which is a diastolic sound, it is one of the differential diagnosis for, right, it is one of the differential diagnosis for mitral stenosis murmur. Right, it is one of the differential diagnosis for mitral stenosis murmur. Okay, and for example, if the myxoma is on the right side, right, for example, if the myxoma is on the right side, then right-sided myxomas, okay, right-sided myxomas, they may cause the symptoms of right-sided failure. Right, they may cause the symptoms of the right-sided failure. So that is about the physical examination findings in patients with the atrial myxoma. Then followed by that, you need to remember one of the very important multiple choice question, that is on the Carney complex. See, Carney complex, it is a part of the familial myxoma. Okay, so familial myxoma, right, familial myxoma, they occur as a part of, right, they occur as a part of the Carney's complex. Now, what all will be the components in this, the Carney complex? We are using the word complex. That means there should be 2 or 3 components in this. These Carney complex contain, number 1, the atrial myxoma, right, number 2, the presence of pigmented skin lesions, right, presence of pigmented skin lesions, number 3, presence of endocrine neoplasia. Okay, so these are the components of familial myxoma, which is nothing but the Carney complex. So you can observe that here, the presence of the pigmentation, right, and next atrial myxoma, and next endocrine neoplasia. These constitute the Carney complex. Then how do you diagnose this atrial myxoma? See, the diagnosis of atrial myxoma is established by echocardiography. Right, it is established by echocardiography, right, or by pathological study of the embolic material. And what is the alternative method of diagnosing this atrial myxoma? That is the cardiac MRI. So cardiac MRI is useful as an adjunct. Now apart from that, we have another investigative procedure, that is contrast angiography. Right, contrast angiography. Contrast angiography is frequently unnecessary, right, although it may demonstrate a tumor blush. So when you do a contrast angiography, it may demonstrate the tumor blush. Now, what is the importance of this particular tumor blush? The tumor blush, it represents that the mass is vascular, right? It represents the mass is vascular. Okay, so that is the importance of the contrast angiography. So first line investigation or the investigation of choice will be two-dimensional echocardiography. Cardiac MRI is useful as an adjunct, and the purpose of using the contrast angiography is that it will demonstrate the tumor blush, and if there is tumor blush, that tells you that the mass is vascular. Then how do you treat these patients with the atrial myxoma? Surgical excision is usually curative. Right, surgical excision is usually curative. Now, right, apart from this surgical excision, the recurrences do occur, right? So how will you follow up these particular recurrences? So in order to see whether there is any recurrence, you need to do serial echocardiographic follow-up. Right, serial echocardiographic follow-up is very much recommended. So that is about the treatment of the atrial myxoma, so which is the most common primary cardiac tumor. Then followed by that, the next important tumors like what we have is valvular papillary fibroelastomas and atrial septal lipomas. See, the most common primary cardiac tumor is your atrial myxoma, whereas the second most common primary cardiac tumor right, the second most common primary cardiac tumor, they are your valvular papillary fibroelastomas and atrial septal lipomas. Okay, now these tumors, right, these tumors, they tend to be benign, right, they tend to be benign, and they usually require no therapy. Right, they usually require no therapy. Although, like when the tumor is smaller in size, they usually don't require any therapy. But if there is large papillary fibroelastomas, they may embolize and cause valvular dysfunction. In such scenarios, they have to be removed. Okay, so if this valvular fibroelastomas, right, if they are larger in size, they have the tendency of the embolization, right, they have the tendency of embolization, or when the tumor is larger in size, they can cause valvular dysfunction. Right, they can cause valvular dysfunction. So in this scenario, they should be removed if they are very large. So in these scenarios, the tumor resection have to be done. Okay, so that is about your valvular primary or valvular papillary fibroelastomas and atrial septal lipomas. So as the name itself tells you, valvular papillary fibroelastomas, they are the tumors which are originating from the valve. Next, now one primary cardiac tumor we have discussed is atrial myxoma. Second one is valvular papillary fibroelastomas and atrial septal lipomas. Now apart from that, we have other primary cardiac tumors. Now what are the other primary cardiac tumors? Other primary cardiac tumors, they include rhabdomyomas, right? They include rhabdomyomas. Then we have fibrous histiocytoma, right? Fibrous histiocytoma. Then we have hemangiomas, right? Then we have hemangiomas and a variety of unusual sarcomas. Okay, so these are the other primary tumors. To summarize all the primary tumors now: atrial myxoma. Number 2, valvular papillary fibroelastomas and atrial septal lipomas. Then we have rhabdomyomas. Then we have fibrous histiocytomas. Then we have hemangiomas. And then we also have sarcomas. Right, then we also have the sarcomas. Okay, see, some sarcomas, they may be of considerable size before discovery itself. Okay, so that is about the primary tumors which are originating from the heart. And we also have the primary pericardial tumors. So primary pericardial tumors, examples are mesotheliomas. Right, examples are mesotheliomas. And these mesotheliomas, they are related to asbestos exposure. Right, they are related to asbestos exposure. And this primary pericardial tumors, the diagnosis may be supported by abnormal contour on radiography. So when you do a radiography, right, when you do a radiograph of this primary pericardial tumors, there will be abnormal cardiac contour. Right, abnormal cardiac contour. Now apart from that, echocardiography is usually helpful, but it may miss the tumors infiltrating the ventricular wall. So the other alternative method of diagnosing this primary pericardial tumor is echocardiography. This is usually helpful, but it may miss the tumors infiltrating the ventricular wall. But what is the investigation of choice for primary pericardial tumor? That will be the cardiac MRI. So cardiac MRI, that will be the investigation of choice. And along with this cardiac MRI, gated CT imaging should be done for all the cardiac tumors. Okay, so that is about your pericardial tumors. So what is the most common primary pericardial tumor? That is mesothelioma, right? And it is related to the asbestos exposure. And how will you diagnose? There will be abnormal cardiac contour on the radiograph. And echocardiography is usually helpful, but it may miss the tumors infiltrating the ventricular wall. And cardiac MRI, it is the diagnostic procedure of choice along with gated CT imaging for all the cardiac tumors. Now, after having discussed about the primary cardiac tumors, let me discuss the secondary cardiac tumors. Secondary cardiac tumors, they are nothing but the metastasis. Metastasis from malignant tumors can also affect the heart. So secondary cardiac tumors are metastasis right, metastasis from malignant tumors can also affect the heart. Okay, and the most often this occurs in malignant melanoma, right? Most often it occurs in malignant melanoma. Okay, but other tumors that are known to metastasize to the heart include the bronchogenic carcinoma. What is the most common tumor which will metastasize to the heart? that is malignant melanoma. And what are the other tumors which will metastasize to the heart? That includes bronchogenic carcinoma, next carcinoma of the breast, next we have lymphoma, then renal cell carcinoma, then we have sarcomas, and then we also have Kaposi's sarcoma, right, which is seen in HIV infected individuals. So these are the other tumors that will metastasize to the heart, right? One of the most common tumor that will metastasize to the heart is malignant melanoma. And apart from that, the other tumors which will metastasize to the heart include bronchogenic carcinoma, carcinoma of the breast, lymphoma, renal cell carcinoma, and then sarcoma. And these secondary tumors, they are often clinically silent, but they may lead to pericardial tamponade. So what will be the complications of your secondary cardiac tumors? That includes number 1, cardiac tamponade, right? Number 2, arrhythmias, right? Number 3, conduction disturbances, right? Number 4, heart failure, and lastly, peripheral emboli. Okay, so these are the complications that can be seen with the secondary cardiac tumors. So to summarize again, most common secondary cardiac tumor is the metastasis. That will be from malignant melanoma. And other tumors that can metastasize to the heart is bronchogenic carcinoma, carcinoma of the breast, lymphoma, renal cell carcinoma, sarcomas, and Kaposi's sarcoma. Most of the times they are clinically silent, but they can have the complications like cardiac tamponade, arrhythmias, conduction disturbances, heart failure, and then peripheral emboli. Then, how do you investigate these patients? See, investigation, the diagnosis, it is often made by echocardiography, right? The diagnosis, it is often made by echocardiography, but the cardiac MRI and CT scan can often better delineate the extent of the involvement. Okay, so the cardiac MRI and as well as the CT scan, it will tell you right, it will tell you what exactly is the extent of the involvement, right? And apart from that, the ECG may reveal regional Q waves. So whichever is the site of wall affected, for example, if the secondary cardiac tumor is present in the anterior wall of the heart, then in the anterior leads, that is V1 to V4, you have the presence of the Q wave. For example, if the metastasis is to the lateral leads, then you will have the Q waves in the lateral leads. Okay, if the metastasis is to the lateral wall, then you will have the Q waves in the lateral leads. 1 AVL, V5, V6, you have the presence of the Q waves. Then, and metastatic tumors, especially lung or breast, may invade the pericardium and result in very large pericardial effusions. Okay, metastasis, right, especially lung or breast, right, metastasis especially from lung or breast may invade the pericardium, right, may invade the pericardium, and that will result in the development of large pericardial effusion, right. So that is about the investigations in the secondary cardiac tumors. Then how do you treat the secondary cardiac tumors? See, surgical resection for debulking or removal is one of the options for treatment. So surgical resection for debulking or removal. Right, surgical resection for debulking or removal, that is one of the options, that is surgical resection. And another option for treatment is the chemotherapy. Chemotherapy may be effective in relieving the symptoms, right? Chemotherapy, it will be effective in relieving the symptoms. And next, followed by that, how will be the prognosis in these patients with the secondary cardiac tumors? The prognosis is poor for all secondary cardiac tumors. Okay, so the prognosis, it is poor for all secondary cardiac tumors, and the treatment is generally a palliative treatment, right? It is generally a palliative treatment. Okay, so that is about the treatment of your secondary tumors. For primary tumors, already I have said you the treatment. Primary tumors, they are resectable tumors, right? These atrial myxomas should be removed surgically due to high incidence of embolization. Okay, because these atrial myxomas, which are primary tumors, they are highly friable tumors. There is increased risk of embolization, so they have to be surgically removed, right? But the problem with the atrial myxomas is recurrence. Already I have taught you. Recurrences require lifelong monitoring with echocardiography, right? And what was the other primary tumor? That is papillary fibroelastomas. They are also benign tumors, right? And even your papillary fibroelastomas, if the size is more than 10 mm, right? If the size is more than 10 mm, even they also have increased risk of embolization, and even they also have to be removed. Which one? The papillary fibroelastomas, right? So that is about your primary tumor and as well as the secondary tumor. Now regarding the secondary tumor, like I have taught you about the development of the pericardial effusion. What is that? I have said you, especially the tumors of the lung or breast, they may invade the pericardium and result in very large pericardial effusion where there will be accumulation of the fluid within the pericardium. So in such case, what you will do? So large pericardial effusion from metastatic tumors, they may be drained for comfort, but the fluid invariably it recurs, right? But the fluid invariably it recurs. Okay, and the next secondary tumor, the next important primary tumor is rhabdomyomas. They may be surgically cured if the tumor is accessible and can be removed while still leaving enough functional myocardium intact. Okay, so that is about the neoplastic diseases of the heart. So let me just summarize everything. These are the essentials of the diagnosis. The pericardium, it is the most common site of involvement in the cardiac metastasis, right? The pericardium, it is the most common site of involvement in cardiac metastasis. Okay, that is for secondary tumors, the most common site will be the pericardium, and most common primary cardiac tumor is myxoma, and most frequent cardiac tumor for all age groups, it is the metastasis, right? Most frequent cardiac tumor for all age groups is the metastasis, and most frequent primary cardiac tumor in infants and in children, that will be rhabdomyoma. So please remember this. So most common primary tumor, myxoma. Most frequent cardiac tumor for all age groups, metastasis. Most frequent primary cardiac tumor in infants and children, that is rhabdomyoma, right? And the pericardium, it is the most common site of involvement in cardiac metastasis. Okay, so this completes the discussion of the neoplastic diseases of the heart. Thank you very much.